Our next speaker is our president, Professor Daniel Kelly, and Daniel's going to talk to us about safety culture within the organisation. Danny.
Hello, tervist. EONS il rum sin ola. So it's very nice to be here. I hope the translation is working. You can understand, you can follow the message. It's very important. This session, I'm going to encourage you to think about your workplace. Think about where you work and what you do in terms of safety. Lena has talked about safety. We've heard about a particular problem with extravasation. I want you in this session to think about your own workplace culture. That is what we mean by that is how things work there. What do people do? How do they behave? How do they dress? How do they treat each other? And the culture of the workplace can be positive and it can be negative, depending on how things work. So if you are working there, what is your leadership? What's the style of the leadership in your workplace? Is it good? Could it be better? Think about these things. Would you like to be the leader? Could you be a good leader? What is a good leader? These are the questions that we have to ask. And another issue that we encourage you to think about from an EONS point of view is what role does nursing have in your workplace? Are you independent, educated leaders? Could you be more educated, more independent, more ambitious? So we encourage you to think about the culture of the hospitals or the clinics in which you're working. Because today's healthcare, these kind of words at the bottom, things need to be faster, more and more patients, less and less nurses. Things need to be better. So quality is always expected to be high, but it must be cheaper. And that is a problem. I'll come back to those three words because in nursing across Europe, it's the same in our country, more and more patients, less and less nurses. So every day you go in, you have to deal with this reality. So what do we mean by a workplace culture? And these are simple definitions to help you to think about that. So it's what makes your organization unique. It's what the sum of its values, what's important there. Its traditions, its beliefs, its interactions, how people interact, the behaviors there, and the attitudes. You can think about that in relation to nursing, but also in relation to your own role. Or it's been defined as it's a system of shared assumptions. We all share the same assumptions, our values, our beliefs, and that's what governs how we work. It's very difficult to challenge those beliefs because they're very strong. And these shared values influence you and me in the way that how we dress, how we act, how we work, and they're very, very strong. But they may never be written down. They're just absorbed in our everyday lives. So if you have a workplace culture that may not be so positive, you need to think about how could we change that. Or, to put it another way, in terms of the theme of today's conference, the culture of the workplace and the safety that we promote in that workplace is what happens when nobody is watching. So when you're on your own with the patient in the middle of the night or at the weekend, and you choose to do the safe thing rather than the unsafe thing, that's what the culture will dictate. So you may find it very difficult to go against the culture, and we would encourage you to think, we've come from different cultures today, different national cultures, but also different workplace cultures. And we'd like you to think about your own workplace cultures today, because that's about learning and thinking and questioning the role of nursing in that culture. And remember those three words: faster, better, and cheaper. Those were the three words that were used in NASA, the North American Space Agency, when they launched the Challenger shuttle back in 1986, 31 years ago. This was their slogan. They wanted to do things faster. Let's get more rockets. We want to do it better, but we have to save money. And very sadly, what happened with this situation, there was a disaster. And the rocket exploded because it was too cold to launch. And the manager said, no, you have to launch. We cannot afford to wait. So those three words are very important because they could also be used in health systems. So it's an important message, perhaps, to think about the danger of being fast but being cheap. Sometimes it doesn't work. However, I think in cancer care, we have more than just physical safety to think about. When people are diagnosed with cancer, they have lots of different needs. And these may include emotional needs, so they need to feel emotionally safe. They need to feel spiritually safe. They need to have their relationships need to be protected. They need to have enough money. They need to be able to survive financially, so they need financial safety. They need embodied safety. What we mean there is if they have surgery or they have loss of hair or they have problems with their bodies, we need to help them feel safe with those changes. And if somebody has an extravasation wound, that's not safety to that person. They also need to have enough information to feel safe. So our job perhaps is to give them information to help them cope with their cancer. And then remember, anybody diagnosed with a cancer, they don't know what the future will hold. So they need to live with uncertainty in a safe way. So this also comes back to the culture of the organization and the way that we work to support our patients. Now, the work environment that you are in is also very important because we can have problems with the nursing staff. Absences, short-term or long-term absences from work. We can have problems with our backs, with our problems with injuries, psychological problems. We can become depressed, we can become anxious, we can have problems going to work. We don't want to go to work today. We just can't do it. So these are problems that come back to the environment in which we are working. And it's a very expensive problem. I don't know about Estonia and your absences here, but nurse absence in the UK costs us about $27 billion, nurses being off sick. And in the US, it's even similar amounts. So if nurses are not protected and developed and helped, then the organisation will suffer. So in your beautiful hospital in Tartu, you need to look after your nurses as well as your beautiful building. That's the message, I think. And in Sweden, which Lena says is one of the most equal countries, they like to try out these exciting things. So what they did there was they had nurses working in elderly care, and they reduced their shifts from 8 hours down to 6 hours with the same money. Isn't that a nice idea? And this is the manager from the unit. It's been tried in various places. So they now have a 6-hour day. Isn't that nice? And so the manager says, since the 1990s, we've had to work more with less people, and we can't do it anymore. There's a lot of illness and depression in the care sector because of exhaustion. People are tired. And the lack of balance between work and life is not good for anyone. This is the manager speaking. So I would say that your nurses, if they're well rested, they will work better. If you have tired nurses, they may not work so well. You may have problems and errors. We have some research that makes us think about shift work, and we heard lots about different shift patterns in your country. In the UK, the longest shift that we work is 12 hours. I know you do longer here. And in the research that's been done, people who work 12-hour shifts, there's evidence that they have more adverse events, so that's like errors or falls or whatever, poorer performance dips the longer that you're on duty, poorer quality of care, and higher risks of patient safety problems. So you need to think through the consequences of shift patterns. And it might be things like drug errors or things not being done, what we call care left undone. So the patient might have their infusion, but nothing else. So they don't have their emotional support or education. And what's less difficult to measure is the impact on the nurses of doing those long shifts. What does it do to your mind, to your motivation, to your ambition? I just put that out there as a question. I don't have the answers today. And we have some research, this is from Switzerland, done by David Schwapak, and he surveyed 9 hospitals in Switzerland, over 1,000 nurses. And over half recognized, this is in Switzerland, which is very good facilities. Over half recognized that colleagues made mistakes sometimes. We all make mistakes. As we said, we're all human. Just under half said that those violations are happening. They're real. Most often they're reported by nurses rather than physicians. So we are more likely to report a problem than our physician colleagues. This is in Switzerland anyway. And it's more often by staff who are not managers. So there's a message there for the managers. Your staff are more likely to report a problem, maybe if they don't have feeling too responsible for that problem. And it's more often in inpatient than ambulatory settings. And what kind of things do they report? In Switzerland, these are the kind of problems: wrong doses of drugs, wrong orders, no pre-med, the wrong rate, intrathecal order is incorrect or missing, patient weight is not recorded. Simple things, easy to forget, easy to overlook. Or even simpler, not washing your hands and stopping someone and saying, have you washed Have you washed your hands before you touch this patient? Performing prohibited procedures in an isolation ward, or decisions being delayed, problems being delayed, patient being delayed. And when the researchers asked those nurses about telling the organisation about safety problems, more than 2/3 of those nurses stayed silent. So that takes us back to the organisational culture. Because if you feel you cannot speak out, then you're not going to tell the truth. So if you make an error, you might try to cover it up. And that becomes a cultural norm, rather than saying, we have a problem, we need to talk about it and learn from it. Half said nothing to anyone. These are nurses telling on a questionnaire. And a third stayed silent even when they had information. So there's an important message here about who does speak up and who does not, and why is that happening. And the predicting factors, so what makes this happen, they suggest that it's what they call a low level of psychological safety. So those nurses do not feel safe to speak up. So maybe they feel they will be blamed or treated badly, so they don't feel safe. So for the managers, you need to make your staff feel safe to speak up about problems. Also, the people who are less likely to report, if you have a very hierarchical system, so lots of layers of decision making, the people at the bottom will not speak up because the people at the top are the powerful ones. So again, awareness of that is very important. We've done some research in the UK about people working with older patients, and it became clear that staff would only speak up if they felt safe. And this is an example of a theory that it's worth thinking about. It's called Normalisation of deviance. And it was used to explain the NASA Challenger disaster. NASA had a culture that had become quite deviant. Nobody spoke up, nobody challenged authority, and so eventually it was a disaster. But the abnormal had become normal. And here's an example from our work in Wales where we asked staff about caring for older people. And the manager said, this was a manager in an older person's facility, he said, the problem, I believe, is sometimes with staff dealing with dementia, the abnormal becomes the normal. People with dementia, they see it every day. So it's a sort of habituation of abnormal behavior, which then leads you to believe, oh, it's okay, when in fact it's not okay. What's happening here is not okay. It's very deviant, it's very abnormal. And people are working, and the example he gave is, they don't smell the urine. The place was smelling of urine, but the staff couldn't smell it. It had become normal to them. And the manager would say, I can smell urine. Can somebody do something about it? So it's a small example of somebody challenging what had become normal. It's a nice example of this deviant behavior. So you might want to think about any examples in your own organizations where the abnormal has become normal. And do we need to stop this situation? And if we don't, what happens perhaps is that we burn out. We give up. We switch off. And this is an example of we disengage in emotional work with patients. We distance ourselves maybe from them and their families, and we adopt what's called a working persona. So it's not really us. It's a cancer nurse, but it's not somebody who works with their feelings. They're very good with the IVs and the machines, but they don't engage on an emotional level. And that's to preserve themselves. It's not to blame them, it's because the culture doesn't encourage emotional engagement. And when it's high stress and constant demand, then the eventual outcome is what's called burnout, emotional burnout. And the symptoms are exhaustion, detachment, and we emphasize physical care over emotional care. And we've all been there. I'm not blaming anybody, but when the work is every day, it's hard, then you can't engage. You have to withdraw to protect yourself. And that brings us back to the RECON project. And what we're trying to do in that project is to take some of these issues and apply it to cancer nursing and have it recognised, to help have it recognised across Europe. So we're doing it in the 3 phases. It's a 3-phase project. Phase 1 is a systematic review of published nursing research that is intended to help patients. So this is like clinical trials, high-level research. That's coming to an end just at the moment. Phase 2, which is where Estonia comes in, we're doing a study in 4 countries. So we're looking at cancer nursing in Estonia, in the UK, in Germany, and in the Netherlands. And we're doing it to compare different countries and how cancer nursing is developing, how it can move forward, how we can use the experiences to call for better education, recognition, development. So we started yesterday at the University Hospital in Tartu, and we did some focus groups, and we got some information from your colleagues, and we're going to use that to start the process of painting a picture of what it's like here in Estonia, some of the issues that you might be facing. And then in phase 3, we're going to be pushing for some changes. So we hope it will result in some real changes, education, accreditation, using the education framework, and really helping you to move nursing forward. And we're doing that by working closely with the ECHO working groups. If you don't know, ECHO has EONS has working groups. So we have communication, we have research, we have advocacy, and we have education. And those 4 groups are involved in this project. So to summarize, and I think it's soon be lunchtime, so you must never keep your audience from their lunch. It's a good piece of advice. So the final message is, and I hope you will think about some of these things. Nursing is a finite resource across Europe. It's becoming quite scarce. And the cancer nurses are becoming very scarce in some countries because they move around for better money. Working long hours is not always the answer. Long shifts may not be the answer to your issues. Well-rested nurses make less errors and they give better care. That's what the evidence suggests. Safety, which is the theme today, is a key concern in relation to the culture of the organizations in which we work. So think about your organizations. Think about what works well and perhaps what could change. And what we want to do in EONS is really understand what cancer nurses could be, what cancer nurses could do across Europe, so that we're all working at the same high level, because it's a fantastic resource. And as the film showed, everybody should be really proud of the work that you do. So we hope you do feel proud today. And I think it's lunchtime, so thank you very much.
So before you dash off, I'm just wondering if anybody's got any questions for Danny? Lena?
Oh, yeah. Thank you, Danny. I want to follow up on the working hours. And you gave the Swedish example of 6-hour shifts, which is probably all crazy for you to think about working 6 hours.
For the same money.
For the same money. And actually, for some years ago, I was the head nurse of a radiotherapy unit, or radiotherapy units in Stockholm. And we did change the shifts from 8 to 6 hours, full pay. And we completely solved the recruitment, turnover, the sick leaves, everything was perfect. We had really problems to retain nurses before, but after that we didn't have any vacancies, of course. The nurses worked from 7 in the morning to 1:30, or started at 1 and finished at 7 with a break. And it didn't cost anything, because we could increase the number of patients treated, so it actually turned out. But it was stopped. Can anybody guess why it was stopped? It was actually stopped by nurses, thinking it was unfair to others that couldn't have the same. So sometimes I think we need to think about how we treat each other, and also think more collectively rather than the sort of personal situation. So that was a shame. Now I know they're missing 19 positions on this ward, and we didn't have any vacancies during this time. So it can work.
Yeah, that's a really good example, Lena, and I suppose it shows about how sometimes being creative and trying something out can actually help and find a solution to a problem.